Welcome to Yazhini Spark channel. Let's heal, learn and go together. Good morning everyone. Welcome to today's section from SNS College of Nursing Coimbatore. Yes, I am Yazhini. Today we are diving into Unit 9 of your BSc Nursing Nutrition course, focusing on Therapeutic Diet Part 1. In this video, we will explore what the therapeutic diets are, and we will be learning about objectives, principles, and how they are modified to support the patient recovery. Let's start and with a why these diets are so vital in the healthcare. We can learn together. Let's start. You will be curious about what is mean by therapeutic diet. First, we start an introduction to therapeutic diet. This unit specially is mean for meal planning, which is all designed for the patient to managing their according to disease conditions. Here it is designed to manage medical condition as a part of holistic treatment approach. These therapeutic diets are prescribed by dietitian and physician, and these diets are planned to bring out the optimized nutrition and to treat the disease conditions and to also support the recovery. In this unit, we will be covering about definition, objectives, and principles and details of the each disease conditions, how will be carry outing the dietary guidelines and various health conditions. These all are we need to know to we have to treat the patients according to their conditions. Let's learn what you mean by therapeutic diet. Goals of therapeutic diet. From the plus sides, I am saying about why we need, what the goals, why we have to follow this diet. First goal is of quality of life. This enhances the patient's life satisfactions and also overall well-being will be coming for the patients. And second is healing. Whatever the disease conditions, and we have to support the naturally body recovery process for the patients. So that is of second is healing. And systematic management, symptom management, that is of each disease condition they will be having different kind of symptoms. So according to that they have to deal about. Then fourth is of nutritional support, and which is each conditions we are having a essential nutrition should be enhanced for the patients. For this nutrition support, main four goals are nutritional support, symptom management and healing, and quality of life. Overview of therapeutic diet. Let's begin with the definition. A therapeutic diet is a specialized meal plan designed to control the intake of certain foods or nutrients, tailored to manage specific medical conditions. Think of it modified version of regular diet, which is prescribed by physician and it was carefully planned by the dietitians. These are the already we have seen the goals. These all are needs to uh, for achieving the goals only. To achieve an individual unique health needs, we have to manage what we call the areas of indiscriminate health status. These diets plays an main role in treating disease and supporting recovery and also optimizing the nutrition. Objectives. Why do we use therapeutic diet? These are the main objectives. Enhance the nutritional status to support healing and recovery. To manage or treat specific diseases or disorders like diabetes or heart diseases, improving eating and digestion, especially for the patients with chewing or digestive issues, and preventing of complications which is caused by nutrition imbalances and such as deficiency or excessive. These objectives ensure the diet align with the patient medical conditions, which is of making it crucial part of a treatment plan. Principles of planning. When planning a therapeutic diet, we follow some key principles to make it an effective way. Ensure a balanced intake of essential nutrition to support overall health. Addresses like nutritional deficiency caused by illness or treatments like chemotherapy. and provide rest to affected organs. For example, reducing stains on the liver or kidneys. Adjust nutrition intake to meet at alternate metabolic demands such as an fever or recovery. Support weight management goals, whether it is a weight gain for malnutrition or a loss for obesity. These principles guide the dietitians to create meal plans that are both therapeutic and sustainable. Dietary modifications. Therapeutic diet often involves two types of modifications. One is of consistency modifications. These changes physical form of food to make it easier to eat or digest. For example, liquid or soft foods for the patient with swallowing difficulties. Nutrition modification is of these adjustments the amount of macronutrients like carbs or proteins or micronutrients like sodium or potassium to suit the patient's conditions. Let's dive deeper into the consistency modification in next part. Consistency modification is a clear fluid diet. That is, a clear fluid diet is a consists of transparent liquid that leaves no distances and are non-gas forming and does not irritate the digestive system. It used short term for 24 to 48 hours, often post-surgical or during acute illness. This diet provides 300 kilocalories and no protein and some minerals, but it is not nutritionally complete. Example includes water, tea, coffee, clear soups, and fruit juices. It helps relieve thirst and hydration tissues and aids in gas removal. This come food full fluid diet. Next is of which a bridge between clear fluids and soft diets. It is of used for conditions like post-operative recovery and acute gastritis, infections, and diarrhea. This diet includes of food liquid at the room temperature like milk, cream soups, and creoles milk-based beverages. It essentially digestible and also provide good nutrition, and it's ideal for the patients which are unable to handle the solid or semi-solid foods. Soft and blend diets. Finally, the soft diets includes of all essential nutrients. It is easy to chew and low in fiber, and it's also blend to support the digestions. The blend diet goes further, avoiding all spices and ornaments, which is to prevent the gastric irritations. It is used in conditions like peptic ulcers and gastrics and ulcerative colitis and during fevers. And food includes milk, butter, soft meats, refined cereals, and plain pudding. These diets reduce the irritations while meeting high proteins or calorie needs. That's all for today's sections on therapeutic diet part 1. We covered the basics like objectives, principles, and key consistency modifications. Join us on next class to explore more dietary modifications, specific therapeutic diet for various conditions. Don't forget to like, subscribe, and hit the bell icon for the updates. See you on next time. Thank you.